Hello, is it Mrs. Brooks?
Yes, yes.
Hello, I'm Dr. Jones. Nice to meet you. Now, here you've come to hospital today because you've had some problems with shortness of breath, is that right?
Yes, that's correct, yes.
And how long has that been going on for?
Well, gradually worsened in the last few weeks, but for the last 6 months it's been a added factor.
Right.
I'm always been chesty, but of late it's gone worse.
It's gone worse, has it? Right. And so you say you've had the shortness of breath problem for the last 6 months?
Yes.
Right. And have you seen your GP about this at
Yes,
all?
periodically, and
Right.
it just gives me antibiotics and then it returns again.
Right, okay. And in the last couple of weeks it's got much worse, has it?
It has, yes. The sputum's gone green.
Right.
And the margin's not as wide. I can't walk very far without shortness of breath.
How far can you normally, when you're well, how far can you normally walk?
Perhaps a couple of 100 yards.
Right. And what about now?
Well, down to probably half that, if that.
Right, okay.
It's really bad.
Mm-hmm. And you tell me you've been coughing up some green sputum.
Yes, I have.
How long has that been for?
Well, for the last week, so I've not been back to my GP,
Right.
but I thought I'd come here and see what you say.
And you've not had any antibiotics recently
No.
for any of this? Right.
No.
Okay. And tell me, do you smoke at all? Have
No.
you ever smoked?
No.
No. Anybody in your family smoke?
My husband smokes.
Right.
He smokes in the house, which I prefer him not to, but
Right.
if I was a baby, what it is.
Yeah, yeah. And have you had a temperature at all with this?
Well, yes, I do occasionally feel a bit grotty and...
Okay.
hmm
And are you on any treatment for this at all? Any medication?
I'm on inhalers and have a nebulizer machine.
You have a nebulizer, do you?
Yes.
Right, okay.
Which I use when it's bad. I use perhaps 3 times a day, but normally I just do mornings and evenings.
Right, okay, okay. And are you on any other treatment apart from the inhalers and nebulizers?
Not for my chest, no. The oxygen part, sorry.
Oh, you're on oxygen as well,
Yes,
are you?
yes.
Right, and you have that at home, do you?
I do,
Right,
yes.
and how often do you?
Again, depending if I do anything like hoovering or things, I have to go on it for a few minutes after that.
And have you noticed that you've been getting short of breath in the night? I mean, how many pillows do you sleep
Well,
on?
I have 3.
Sleep on 3
normally.
pillows,
Yes.
right, right. And have you woke up recently with short of breath in the middle of the night?
Yes, and of course if I have to go to the bathroom, that doesn't help either.
Right, okay. And any ankle swelling at all?
By evening, yes.
You can get some swelling in your
Yes.
ankles as well, right, okay. And any other medical problems? You have high blood pressure or high cholesterol?
No, I do have a bit of angina.
You do have a bit of angina as well. Do you have a spray for that?
I do have a spray, yes.
Right.
And I'm on some daily medication.
Right, okay. Well, I'll have a look at those medications in a bit, if that's okay.
Yes, that's fine, thank you.
Good. Can I examine you now?
Certainly.
Would that be all right?
Yes,
okay,
thank you.
thank you. Okay, great. Can I just have a look at your hands first? Can you just put them out in front of you for me? Okay. And just put your arms out and cock your wrists up for me. Okay, good. And I'll just take your pulse now. Good, that's fine. I'm just going to rest your head back on this pillow a second, if that's all right. And if you just turn your neck just slightly to the side, the other way, that's it. That's great. Thank you. Okay, good. That's fine. Can I just sit you forward so I can have a listen to your chest? Pull this up at the back. Is that all right?
Yeah.
Okay. Can you take a nice deep breath in and out for me? And again. Okay. I'm just going to have a listen to your chest. There's some nice deep breaths in and out of your mouth for me now as well. Deep breath. Good. And I'm just going to press on your back. Okay, that's fine. And I'll just pull that down for you.
Thank you.
Okay, can you just stick your tongue out for me a second? And up. Stick your tongue up. That's it. Good. That's fine. Fine. Okay, and I'll just have a look at your ankles if that's okay. Okay, do you have any pain or tenderness in your ankles at the moment?
The right one.
The right one, okay. I'll just be gentle.
Not bad. Just lower down.
Okay.
Okay, you have 2 minutes remaining.
Good, that's great. Do you have any worries or concerns at the moment?
Well, I'm worried that, I feel I'm ready for some more antibiotics, or it will flare up again and I'll be in more serious trouble.
And when did your GP last prescribe you antibiotics?
2 weeks ago.
2 weeks ago, right, okay. Now, have you heard about this condition called COPD?
Yes, I believe I have that.
Right, okay, that's what you've been diagnosed with
yes.
by your GP. I'm worried at the moment, like you are, that you've got what we call an exacerbation of that, and caused by infection. Particularly with this green sputum and in temperatures. I think it might be a wise idea to start you on some antibiotics or some stronger antibiotics.
Yes,
now, I think what we need to do first of all is get you a chest X-ray.
Yes.
We need to do a few blood tests. We need to take a sample of blood from your wrist, the arterial blood gas. I'm sure you've had that before,
yes,
have
indeed,
you?
Yes.
I'm sorry, it's not very nice, but
No,
I think we ought to do that. And I'm going to ask the nurses if they can come and give you some nebulizers at the moment.
Yes, thank you.
And I think we may have to put you on some steroids as well. I don't know whether you've had those in short courses in the past as well. Right, okay. Would that be okay? I mean, I think you're probably going to need to stay in hospital for this treatment for a little while until we can sort out what's going on.
Well, obviously I'm in your hands, Doctor. Thank you.
Right. Okay, thank you.
What are your findings for this patient?
This lady had evidence of cor pulmonale, probably secondary to her underlying COPD. She had a loud